My name's Darryl Hawkins. I'm an occupational therapist working with disability services in Tasmania. We don't really have a typical work day, but we work with people with intellectual disability that have challenging behaviour. So my job is to assist people that are supporting someone with an intellectual disability to enable them to live the life that they like. Initially I was completing an exercise science degree. I finished that degree, but in my final year I met a couple of OTs on a program that they had established through the burns unit at the Royal Children's Hospital. And by participating in their program as a volunteer and seeing more about what OTs did and having a broader view of what occupational therapy is about, made me apply and do OT the next year. The best thing about being an occupational therapist is being able to work with somebody to make a significant difference in their life. For example, 2 years ago I ran a wilderness program for our clients with intellectual disability in Tasmania, and we took 7 clients into the bush for a week. There was one particular fellow that came with us on that time who had significant psychological issues alongside of his intellectual disability. And coming away from that program, he became involved in his community. He's established a group where he goes camping regularly now. He's involved in a community garden, and he goes and has coffee with people every morning. So seeing the difference between where he was coming into a program like that and where he was able to come out, and having his organisation support him with that change process was really rewarding. Other things I've been involved with is I took a group of students, third-year occupational therapy students, over to Nepal to work with a local non-government organisation in a rural village. The village had identified education as being their biggest issue that they wanted assistance with. So as occupational therapists, we understand that education is a key occupation, or key thing that kids do and need to do in order to develop into useful, productive adults. So we assisted the local non-government organisation and the village in a number of different ways in order to engage children within that education system. Now's a good time to become an OT because of the emphasis put on function in general healthcare. And by function we mean what people can do. It's not just about disease and illness anymore, it's about what people can do apart from that. And the World Health Organisation, with their ICF, which is the International Classification of Function, puts a great responsibility on the occupational therapy profession to push occupation and to push what people can do, and it fits really nicely with their framework.